Welcome to the Expert Series, brought to you by the Lupus Foundation of America. Our health education team is here to bring you experts in lupus to discuss topics to help you live better. Thank you for tuning in to today's episodes. My name is Alyssa, and I'll be your host. I am very excited to welcome one of our health education specialists and manager, Ashley Holden, who will talk to us about what step therapy is and how it affects people with lupus. Ashley has a Bachelor of Science degree in Public and Community Health, a Master of Education in Health Education, and is a nationally certified health education specialist. Ashley has several years of experience in the health education field, including health insurance knowledge from her time as a worksite wellness consultant for different health insurance companies. We are very delighted to have you join us today, Ashley.
Thank you so much for having me.
All right, let's jump into these questions. So the first one we have here is, what is step therapy and how does this affect people with lupus?
Okay, so the simplest way to explain step therapy is that it means trying less expensive medications before stepping up to other medications that can cost more. So, step therapy is a restriction on insurance coverage that requires patients to prove that less expensive drugs are ineffective in their treatment before getting coverage for more expensive medications. So, when a medication is subject to step therapy, the insurance company requires the patient to first try a different medication chosen by that health insurance company. After demonstrating that the medication chosen by the insurance company has failed to successfully treat that patient's condition, the patient is then able to access the medication originally prescribed by their provider. You may also hear step therapy protocols referred to as fail first because you have to fail that first medication before trying the next one. People with lupus often take several medications, and many argue that step therapy undermines the patient's health and prevents them from accessing appropriate treatment. The doctor may not be able to put the lupus patient on their first choice medication. The process of trying different medications can sometimes take weeks or months until that person fails the medication and they're allowed to step up to the next, more expensive option. The process can be physically, mentally, and financially challenging for the patient.
Wow, thank you for that information. Can you explain to us, why does step therapy exist and what are some challenges associated with it?
Right. So, step therapy is a practice that health insurance companies use with the hope that it will save them, the health insurance company money, and some argue that there are benefits of step therapy. So, because it requires a tiered approach, it can prevent doctors from making unusual treatment choices or prescribing riskier new medications, and instead have to try those proven treatment options first. But as I mentioned earlier, it can prevent a doctor from treating a patient with their first choice medication immediately. And that process of trying or failing medications can be detrimental to that person's health since they're not able to take the medication their doctor feels is the best choice for their situation. The whole process of getting approval for the medications can take time, which can delay treatments. And we know for people with lupus, even one day without the medication their doctor's prescribing can be extremely dangerous. And so step therapy can lead to chronically ill patients like those with lupus having to pay more out of their own pockets. Patients have to pay for each of those medications they're trying in that step therapy process. And so sometimes you may have to try a few different drugs, and you're paying copays for each one of those that you may only be taking for a short amount of time before stepping up to the next one. And, step therapy can also result in that forced drug switching, treatment gaps, and it can stop or delay effective treatment. And all of that has the potential to cause disease flares or other adverse effects. And I also want to mention that because of those delays in getting effective treatment and finding relief, some patients will stop taking medications altogether and won't fill their prescriptions because they're so frustrated and the way that they're feeling. I mean, we know that not getting medications or being on medications can really lead to poorer outcomes in lupus patients and potentially organ damage.
So it can do a lot of damage for people with lupus. Why is it important to know about step therapy? And is step therapy different from prior authorization?
So prior authorization, or sometimes you'll hear it called prior auth, is a management process by health insurance companies to determine if a service or a medication will be covered and how it will be covered. So, what percentage they'll pay for it or if it's covered in full. And step therapy is actually a type of prior authorization. So they kind of go hand in hand. It's important to know about step therapy so that you and your doctor can navigate the process together. Sometimes people are not aware that this exists, and so it comes as a shock that they have to go through this process. So before an appointment, you can check with your health insurance company to see if they require step therapy. And like I said, by knowing that step therapy practices exist, you can discuss your plan of action with your doctor. And just being aware of step therapy, it takes away the shock of having to try those different medications prior to stepping to the next medication. And like I said, it's something that you can have that conversation with your doctor if you know that it exists. They might change what they're prescribing, or like I said, you can make a plan for that step therapy process.
Okay. And can someone with lupus avoid the process of step therapy?
So that's a good question. And so most health insurers do have step therapy practices. And so I would say if your health insurer does have step therapy, contact your doctor. So there's a couple of different options. There may be another medication that he or she can prescribe to treat your condition without requiring step therapy, or they can prescribe the first medication to start the step therapy process that at least gets you started on a medication as you go through that process so that you're not delaying some type of treatment. And then also, I would say while most health insurers do have those step therapy protocols, there's actually a process to apply for an exception to step therapy. But very rarely patients know that this option exists. So if your doctor feels it's medically necessary to skip the step therapy process, you may be able to qualify for an exemption from your insurer. Discuss your situation with your doctor, who will talk to your insurer to explain why you need the medication right away and why the restriction should be lifted. And like I said, there are times where exceptions can be granted. So it's really important that you have an open, honest communication with your doctor and that your doctor works with your insurance company to try to get you that medication.
And how can people with lupus advocate for themselves when it comes to their health care?
So that's a really great question. And, I think when it comes to healthcare, one of the most important things we can do is to understand how our health insurance works. And I know that health insurance can be confusing. And I know that most people don't understand the basics of their coverage, and rightfully so. Like I said, it is very confusing. But by knowing how your health insurance works, it can help you navigate the healthcare system with less chance of ending up with costly, unexpected medical bills. It could also allow you to be able to access your services in a more timely manner. And unfortunately, that shouldn't be the case, that you have to know that in order to be able to access those benefits. But again, by having that knowledge, hopefully it'll help you navigate that a little better. I'd also say, don't be afraid to speak up for yourself or ask questions. And so, prepare for your doctor's appointment ahead of time, and you can make a list of your questions or concerns. And if you feel like something's not right or something's delaying your care, talk to your doctor about it. Have that open and honest communication. I also like to remind people not to forget to keep copies of their medical records and review medical bills for errors. And don't be afraid to call your provider's office or health insurer and ask questions if you receive a bill if something doesn't look right on it. Definitely call. They can resubmit those bills so that you're not getting unexpected costs out of pocket. And then finally, I'd like to encourage lupus patients to know when a second opinion is appropriate. So generally, any recommendations for a major non-emergency surgery, any questions about the validity of your diagnosis, and any concerns you may have about being heard are really good justifications for a second opinion. And finally, I'd also like to mention that the Lupus Foundation of America is actively working at both the state and federal level to enact policies that limit the use of step therapy. I definitely encourage you, if you haven't already, to visit lupus.org and sign up to be an advocate.
Wow, thank you so much for your informative answers, Ashley, for talking to us about step therapy. We appreciate your time and expertise. We invite those of you listening in to check out our past episodes of the Expert Series by visiting lupus.org/the Expert Series, where you can also subscribe to get alerts when podcasts are released. If you have a lupus-related questions, you can reach out to health education specialists like Ashley by email at lupus.org/health-educator or by phone at 1-800-558-0121. You can also find more information on understanding and living with lupus at our National Resource Center on Lupus at lupus.org/resources. And finally, we'd love to hear from you. If you have any questions or comments, or have a topic that you would like to see covered, please email us at info@lupus.org. Thank you and have a wonderful day.